Hello everyone, welcome to Ultrasound Academy. Today we will discuss one of the most important fetal biometric parameters used in obstetric ultrasound, femur length FL. By the end of this lecture, you will understand what femur length FL is, why it is measured, when it should be measured, correct ultrasound technique, normal values, clinical significance, common mistakes, causes of short femur, tips to obtain accurate measurements. Whether you are an ultrasound student, sonographer, radiologist, obstetrician, or medical professional, this lecture will help you master femur length measurement. What is femur length FL? The femur length FL is the measurement of the ossified diaphysis, shaft, of the fetal femur. It is measured from one end of the ossified shaft to the other. The femur is the longest bone in the fetal body, one of the most reliable parameters for fetal growth assessment, less affected by fetal head shape than BPD. Why is FL measured? Femur length helps in heavy checkmark estimating gestational age, heavy checkmark assessing fetal growth, heavy checkmark calculating estimated fetal weight, EFW, heavy checkmark detecting skeletal abnormalities, heavy checkmark diagnosing growth restriction, heavy checkmark screening for chromosomal abnormalities, heavy checkmark monitoring fetal development. When is femur length measured? FL is routinely measured during first trimester, usually not measured routinely. CRL is preferred. Second trimester, most accurate period, 18 to 22 weeks. This is part of the anomaly scan. Third trimester, used to monitor fetal growth, estimate fetal weight, detect growth restriction, compare with previous scans. Anatomy of the femur. The fetal femur consists of proximal end, shaft, diaphysis, distal end. Only the ossified shaft is measured. The cartilage at both ends is not included. Equipment required. Curvilinear probe. Frequency 3 to 5 MHz. Obstetric preset. High-resolution imaging. Proper magnification. Patient position. Mother lies comfortably in the supine position. Slight left lateral tilt if needed. Ensure maternal comfort. How to obtain the correct femur view. The femur should appear heavy checkmark straight, heavy checkmark horizontal, if possible, heavy checkmark entire shaft visible, heavy checkmark bright echogenic bone. Both ends clearly visualized. Correct measurement technique. Zoom the image. Locate the longest femur. Align the ultrasound beam perpendicular to the bone. Visualize upper end, shaft, lower end. Place calipers at outer edge of ossified shaft. 2. Outer edge of ossified shaft. Measure only the ossified diaphysis. Do not include cartilage. Important rules. Always measure heavy checkmark longest femur, heavy checkmark straight femur, heavy checkmark ossified shaft only. Avoid cross mark curved femur, cross mark oblique section, cross mark shadowed bone, cross mark foreshortened image. Why the longest femur? Because oblique imaging shortens the measurement. A short measurement may falsely suggest growth restriction, skeletal dysplasia, incorrect gestational age, normal growth pattern. FL increases almost linearly throughout pregnancy. Approximate values. Gestational age with FL. 14 weeks equals 16 mm, 16 weeks equals 23 mm, 18 weeks equals 29 mm, 20 weeks equals 33 mm, 22 weeks equals 38 mm, 24 weeks equals 43 mm, 26 weeks equals 48 mm, 28 weeks equals 53 mm, 30 weeks equals 57 mm, 32 weeks equals 61 mm. 34 weeks equals 65 mm, 36 weeks equals 69 mm, 38 weeks equals 72 mm, 40 weeks equals 74, 78 mm. Values vary slightly with different reference charts. Femur length in fetal weight estimation. FL is combined with biparietal diameter, BPD, head circumference, HC, abdominal circumference, AC. These measurements calculate estimated fetal weight, EFW, using formulas such as the widely used Hadlock equations. Clinical importance. FL helps detect normal fetal growth, intrauterine growth restriction, IUGR, large fetus, skeletal dysplasia, chromosomal abnormalities, limb abnormalities. Causes of short femur. A short femur may occur due to incorrect gestational age, wrong dating. Most common cause. Constitutional short stature. Parents are naturally short. Baby is healthy. Fetal growth restriction. Reduced blood supply. Placental insufficiency. Poor nutrition. Skeletal dysplasia. Examples include achondroplasia, thanatophoric dysplasia, osteogenesis imperfecta, chromosomal abnormalities. A short femur can be associated with increased risk of conditions such as Down syndrome when accompanied by other ultrasound findings or screening results. An isolated short femur, however, is often due to normal variation and should be interpreted in the full clinical context. Long femur may be seen in large fetus, tall parents. Normal variation, usually not clinically significant. Common errors. Never measure. Cross mark entire leg. Cross mark curved femur. Cross mark shadow. Cross mark cartilage. Cross mark distorted bone. Cross mark oblique section. Tips for better measurement. Zoom image. Wait for fetal movement. Measure when femur is horizontal. Use highest resolution. Measure twice. Record best image. Quality checklist. Before saving the image, ask, heavy checkmark entire shaft visible? Heavy checkmark ends clearly seen? Heavy checkmark no cartilage included? Heavy checkmark bone straight? Heavy checkmark proper caliper placement? If yes, save image. Comparing FL with other parameters. Parameter and purpose. CRL first trimester dating. BPD head width. HC head circumference. AC abdominal size. FL long bone growth. All are combined for complete fetal assessment. Practical scanning tips. If baby is moving, wait patiently. If legs are crossed, ask mother to change position. If image is unclear, increase gain appropriately. Zoom image. Use focal zone correctly. Reporting example. Femur length, FL 38 millimeters.
Corresponds approximately to
22 weeks gestation. Normal appearance. No evidence of skeletal abnormality. Key points to remember. Measure only the ossified shaft. Do not include the epiphyses or cartilage. Use the longest visible femur in a true longitudinal view. FL contributes to gestational age estimation and fetal weight calculations. Always interpret FL alongside HC, AC, BPD, clinical history, and previous growth scans. Conclusion. Femur length is one of the most reliable fetal biometric measurements in obstetric ultrasound. When performed with proper technique, it provides valuable information about fetal growth, gestational age, estimated fetal weight, and the possibility of skeletal or chromosomal abnormalities. Accurate imaging, correct caliper placement, and interpretation within the overall clinical picture are essential for high-quality obstetric ultrasound practice. Thank you for watching. If you found this lecture helpful, please like, share, and subscribe to Ultrasound Academy for more comprehensive ultrasound tutorials. Don't forget to turn on the notification bell so you never miss our upcoming educational video lessons. Happy scanning, and see you in the next video.